and welcome into To Your Health. You know, about 12 years ago, I had cataract surgery. But the way I did it was I was wide awake. We actually went into an operating room, put a microphone on me, and the other microphone was put on Dr. James Izer.
Yep.
And that was a first for you, wasn't it?
Oh, it was first at the surgery center. They had never had it done live
for
before.
those people also.
That's right.
And the reason we did that, Dr. Izer, was we wanted our viewers to realize the fact that it is a non-painful, simple procedure.
Correct. So most people have it done in a very short period of time with minimal anesthesia, so there's really reduces the risk of anesthesia complications, and in and out in about 15 minutes typically, and headed home about 10 minutes after that.
And usually just do one eye at a time.
Correct. You just do one eye at a time, but you can usually, if both eyes need to be done, you can usually space them out within a short period.
That's great. And the thing is this, that everybody has cataracts.
Correct. If you get to about 55 or 60 years old, you start to get a cataract.
And that's kind of like a little coating that goes over your eye.
So it's the natural lens in the eye, which is supposed to be doing the focusing, starts to get cloudy over time. And when it's cloudy, it doesn't want to focus like it's supposed to.
Okay. So when this is happening, obviously when you're in for your regular eye exam, you're able to check that, aren't you?
Correct. When everyone is in for the regular exam, we're looking at them through the microscope. One of the things we're looking at is for the presence of cataracts.
And then once that happens, and we say it's usually, when you get to be about age 50, 60, it increases the incidence where you may have to have surgery for it.
Correct. So it all depends on if it's causing you problems. So if you're having trouble seeing, and if there's not a simple solution like a glasses change, then that's when we start talking about doing something with the cataracts.
And as you said, it's a simple procedure. We talked through the whole thing.
We did, yes.
Which was very nice. Now, glaucoma, that's another thing that affects people as they grow older. What basically is that?
So glaucoma usually involves the pressure inside the eye.
Okay.
So in some people, the pressure inside the eye is higher than we like it to be, and that unfortunately can damage the nerve that goes to the brain, and it can cause vision loss. It can happen at any time, but it's more likely the older that you get. So certainly as you get into your 50s, 60s, 70s, it's a good idea to have your eyes checked on a regular basis, just to do a normal pressure check, which is part of every eye exam, to make sure there's no signs of any problems with the pressure.
And then if something has to be done, is that a more complicated procedure?
It is, because when we're dealing with cataracts, surgery takes care of the problem. Glaucoma is a problem that has a long-term treatment. So there are eye drops that most people use to get the pressure down, or there are other procedures that can be done, lasers or surgeries in certain cases that can help out as well, but that's more of a long-term problem.
So what we would suggest is when you get past the age 65, yearly basis, see an eye doctor, an ophthalmologist.
Correct. It's a good idea to see things that sometimes we can catch early on, and if there is a problem, treating it before it gets to cause any problems with your vision.
Thank you so much, and just remember this, it's your eyes. You want to be able to see those beautiful grandchildren. Take good care of them, and we'll be right back right after this.